Good afternoon, everyone. Thank you for coming along to this session. My name is Chris Lawlor. Unfortunately, I'm not a professor. I'm not medically trained. I do not have any medical qualifications, although I do work for the GMC, so can talk a lot about our work and our standards and our requirements. But if there are any medical emergencies, I would be next to useless. So do not come looking for any advice from me on that front, but hopefully I can talk to you about the GMC and particularly focusing on our Welcome to UK practice workshops that we run. I'll talk a bit about what the workshops are, who they're aimed at. We've got the chat function, so feel free to ask any questions as we go through the session, whether it be about processes, about the slides we're talking about, whether it be about something totally off topic. I'm happy for any questions. If we don't get time to cover everything in the next sort of half an hour or so, I'm conscious of not running over into the next session. I will be in the GMC booth for the next couple of hours, so you can drop by and ask any questions that we might not have time to answer today. So first and foremost, what is Welcome to UK Practice? So it's a free half-day workshop that the GMC run and offer for any doctor who has gained their medical qualification overseas. So prior to the pandemic, so 4 months ago, when the world was as normal as we used to know it, these sessions would be run in GMC offices. They would be run in trusts around the UK, and they would be face-to-face sessions where we would gather groups of doctors together who had gained their qualifications overseas, and they would meet up and we would give them an introduction to the General Medical Council. We would look at a lot of our ethical guidance. We would discuss common challenges that doctors may face who have recently moved to the UK. And I guess most importantly, it's a good way of doctors networking. So doctors who are all in very similar situations, perhaps new to the NHS, new to the area where they are living and working, is a really good way of allowing those doctors to build relationships and network with each other. Obviously, 4 months ago, things were put on hold as the world and the UK went into lockdown, and we are not yet running these sessions face to face again as we used to. But what we have started doing over the last few weeks is running these sessions online. So if you go to the GMC website and you search for Welcome to UK Practice, there's more information about the sessions there. You can register for future sessions. You can register your interest in online sessions if that's something that you would be interested in. And the aim of Welcome to UK Practice, so this is a very high level aim really. We go into a lot more detail in the sessions that we run, but it's really to ensure that doctors who are new to practice in the UK have a better awareness and understanding of GMC guidance to assist them in practicing in a manner that protects patients. So as I said on the last slide, it is a very high level introduction to the GMC, who we are, what our role is, and then an introduction to a number of the key pieces of guidance that we produce for doctors. And a lot of the session focuses on the differences that doctors will find from countries where they've gained their medical qualification, perhaps worked previously, and a lot of the ethical challenges that doctors are likely to face once they are working in the UK. So this is what we are going to run through in the next 25 minutes now. So we're going to do some welcoming introductions, find out sort of who's in the session, what people's background are. We're going to do some focusing on the GMC guidance and where you can find sort of learning resources to help support you in your future careers. We're going to think about what makes a good doctor. So, I'm sure many of you in the session are already qualified doctors, so we'll get you to think about what you expect of a good doctor. The fourth point there, I think it's probably unlikely that we'll have time to do lots of the ethical scenarios. We maybe do one or two, but you can find those via the learning resources as well. So before we sort of get into the bulk of the session, a big welcome from myself. So as I said, my name is Chris Lawlor. I am currently sat in my spare bedroom office in Manchester. It's quite grey and dreary outside, a typical Manchester afternoon, but I'd be really interested to hear where people in the session are from. Are you based in the UK? Are you currently overseas? Where have you gained your medical qualification? So any sort of details like that, if people would like to pop that into the chat, that would be useful for me. So we've got Mohammed there from Bangladesh in ophthalmology. I'm looking to move into car and looking to move. Got a final year medical student from Pakistan. Another final year medical. Oh, sorry. Anyone else in those? We just got three. Oh, so we've got Jane, who's not qualified yet, a medical student from in Kenya. Got the Philippines. And this is so practicing doctor in Chennai. So this is a really good example, and it's actually worked better than I probably expected it to on the chat, because this is something we would do in a face-to-face room, and we would use this as an opportunity to get the group to introduce themselves. But what this really does show is that doctors come and work in the UK, and particularly in the NHS, from all over the world. So we've just had sort of 7 or 8 of you there introduce yourselves, and I'm sure in the future you are all hoping to come and work over in the UK, and you are coming from all parts of the world. I'm sure the weather in lots of the places that you are based at the moment is much nicer than it currently is in a grey Manchester. But it's just a demonstration, really, that once you make that decision, once you join the register, once you find a role in the NHS, there will be lots of doctors who have either made the same decision as you and have been on the journey that you will be on, deciding to settle in a new country, in a new region, and learning that the complexities of working within the NHS. In terms of some facts and figures, we estimate on average about 50% of new doctors who join the GMC register on a yearly basis have gained their medical qualification overseas, and that in turn works out at about 33% of doctors on the GMC medical register gained their qualification overseas. So there's about 300,000 doctors on the register. So around 100,000 of those doctors, have been in your position at some stage of their career, and they've gained their qualification overseas. They've maybe worked overseas for a while, and then they've made that decision to come and live and work in the UK. So really like to just stress that the NHS is reliant on doctors or medical students like yourselves who are looking in the future to come and live and work in the UK. And once you do make that decision, you will certainly not be alone, and there will be lots of colleagues around you who have been in the similar situation and will be able to share their experiences with you. A quick question come through. So that question, if you want to come along to the booth, the GMC booth after the session, then we could have a chat about that. Don't want to get too sidetracked with the sort of ins and outs of individual situations. But if you want to come along afterwards, we can have a talk about that and try and find some answers for you. So again, once you make that decision, you will be welcomed, to the UK and to working in the NHS. Over the last few years, there's been lots of high-profile media coverage around certain aspects of the UK and maybe not wanting, people from overseas to come and live and work in the country anymore. But from an NHS perspective, that could not be further from the truth. And the NHS is absolutely reliant on doctors and other medical professionals training overseas and then choosing to come and work in the NHS. So a little bit about myself. I'm part of the GMC Regional Liaison Service. So my role is basically to come and meet with doctors on a regular basis. So prior to the UK going into lockdown 4 months ago now I think it was, on a daily basis, I would be out meeting doctors, medical students, and talking about the work of the GMC and promoting the guidance that we produce. But most importantly, meeting face to face with doctors and receiving feedback and giving doctors that opportunity to have face to face discussions with their regulator. So hopefully in the coming months, we will return to some form of normality and we'll be able to do that again. But in the meantime, been running lots of virtual sessions like this to support doctors as best as we can during the pandemic. It's just a selection of the standards that we have available, and some we are going to touch on as we move through this session. If you are not aware of any of the GMC guidance, if you've not looked at any of this yet, the one in the middle of the slide, good medical practice, is the main piece of guidance. And when you apply for registration with the GMC, there will be a box that asks if you have read good medical practice. So if you don't look at any other GMC guidance after this session, then I would advise having a look at good medical practices as being the key piece. You can access it all on the GMC website, all available to download. So do have a look at that as if you are preparing to do maybe PLAB 2 in the future. If you're preparing for exams, then having a look at this guidance can be really useful. There is also online sort of assessment tools that we have available. So again, you can test your knowledge and understanding of GMC guidance through using this online tool. If you are looking to move over to the UK in the near future and you are waiting for sort of PLAB 2 dates, waiting to complete exams, then we've received feedback that this online tool can be really useful. So head to the GMC website, find the promoting professionalism page, and you can then carry out a number of assessments and increase your knowledge and understanding of GMC guidance. So I'm going to move on now and again ask you guys to get involved. So what do we think makes a good doctor? If some of you are already practicing doctors, some of you are medical students, you will all be at different stages of your career. You are working in different countries. You will all have very varied and different experiences. But what do you expect of a good doctor? What do you expect of yourself if you're a doctor, or if you're a medical student in future? What do you expect of yourself to be a good doctor? Or when you've looked at colleagues, what do you see in colleagues that makes a good doctor? Again, just pop any words into the chat box. So we've got patient orientated, safe and friendly. Yep, I think a good start being patient orientated and then Second one, having patients' needs at the centre of your practice. And that is the opening paragraph of good medical practice. If you go away and read that guidance, it talks about good doctors putting the needs of their patient first and foremost. Approach is absolutely key. We've got excellent communication, teamwork, safe and ethical, great listener, optimistic. I like that one. I've not come across that before. Efficient. So a lot of those points there are sort of those interpersonal type skills. So we've talked to committed to continuous improvement. So we've talked a little bit about sort of being patient orientated, working in a safe way, but a lot of the words that you have used in the chat there are not about your actual practical skills. So it's not about how you carry out an operation, how you treat a patient. A lot of the skills that you are talking about there are interpersonal skills that can be learned and developed over time, and actually the skills that patients expect, really. So I will show you last comment there, being able to put your own health. Yeah, so being able to put your own healthcare first. So looking after yourselves is also vitally important. So a couple of years ago now, the GMC carried out a very small survey where we just emailed a number of members of the public, and we gave them a free text box, and we asked them to tell us what do they, as members of the public, as patients, what do they expect of a good doctor? What makes a good doctor from a patient's perspective? And the bigger and bolder the word on this slide, the more it was said by the respondents. And a lot of these you've covered off there. So the biggest one was listening, and we've got listening there in one of the responses. And actually, that's something that often gets missed when I talk to doctors about this question. They forget that they need to listen, and you need to listen to your patients, to your colleagues. You need to be open to take that advice. We've got communication, understanding. We've got colleagues, which I think links in with team working. So lots of the words on there, as I say, are about interpersonal type skills. We've got a bit on the left-hand side, we've got skills and knowledge, but apart from that, really, the questions here aren't about your clinical competence. I think that patients go to see a doctor, whether that be a GP, whether they be going to hospital, whatever the circumstances are. I think patients accept that a doctor that they are seeing has a level of clinical competence, and actually what makes the experience more positive and what makes it better for a patient are those interpersonal skills. So being able to communicate it in a way that the patient is happy with and understands, and listening to what the patient has got to say, treating them in a compassionate way, being understanding of the patient's needs. So something to bear in mind as you move forward. A lot of the skills that patients will expect of you are not the clinical competence skills. They are the more behavioral type skills. So think about those behaviors as you progress through your career. So linking into lots of the words that were on that slide, I think is probably trust. So patients have to have a level of trust in doctors, and when a patient comes to see a doctor, they expect that you will keep information that is shared with you confidential, and the basis of that patient-doctor confidentiality is the trust that patients have in you, I think. So there's a survey that's carried out on a yearly basis in the UK at a company called Ipsos Mori, and they go out to members of the public and they just ask, which professions do you trust and which professions do you not trust? So do you think doctors are a trusted profession in the UK? Yes or no? I'm going to show you the top 5 trusted professions in the UK. Do you think doctors are likely or unlikely to be on this list? just put some comments into the chat box. So we've got a likely, we've got yes. Yep. A few yeses coming through it. Anybody disagree? Anyone think doctors are not going to be on the trusted professions list? Doesn't look like anyone's going to disagree with the yeses that we've got coming through it. And of course, it would be a bit disappointing if I was sat talking to a group of doctors or aspiring doctors talking about the importance of trust, and then doctors weren't on this list. So as you can see there, doctors are actually second on the list. So over the last few years, doctors have been first or second on this list with 93% sort of public trust in them. That is extremely high, and that demonstrates that the level of trust that the public have in doctors. So doctors number 2, who do we think might be number 1 on the list? Who could be more trusted than a doctor? A lawyer? So lawyers are actually somewhere in the middle. Ah, there we go. Nurses. So nurses are actually the number 1 trusted profession in the UK. So nurses were actually only introduced to this survey 3 years ago now. And as soon as nurses were introduced, they've pipped doctors to the number 1 spot. Why do you think nurses might be slightly more trusted? There's not much in it, 95%, 93%, but what reason do you think nurses might be more trusted? Yeah, exactly. I would agree with that. They spend a bit more time with patients, maybe interact a bit more with patients, have a bit more time to be exactly that, involved in one-on-one care. So often think doctors, you're going around making very difficult decisions, putting care plans in place, and then it's kind of over to the nurses to maybe spend a bit more time with the patient. So that would be my thinking behind it, but just shows in terms of the medical profession, you are right up there in the UK at being the most trusted professions that we have. So I like to flip it round and just show you who comes bottom of the list, just for a bit of a joke, really. So these are the bottom 5, the least trusted professions in the UK. Some of them will come as no surprise to some of you who have been following the UK news over the last 12 months to 2 years, perhaps. But one I like to point out on here in these sessions for doctors who have either just moved to the UK or are planning to move to the UK in the future is that estate agents are actually on there at number 5, the least trusted professions. So when you do make that move, if you are thinking about, buying or renting a property in the UK, then maybe remember this slide when you are speaking to estate agents and make sure that you get all the information that you need. So we're going to just do a couple of quick scenarios now before we finish things off. Got 5 minutes, don't want to overrun too much, but going to think about some medical scenarios that you would find in the workplace. So I'm not going to tell you how to treat patients. As I've said, I'm not a qualified doctor, but I'm going to get you thinking about sort of the ethical scenarios and what you would do in the workplace if you were here working in the UK. First scenario is you are a doctor working in the UK, so you've been working on the ward for a number of weeks now. It's your first placement, and you've been treating an elderly patient. This elderly patient's been on the ward for 3 or 4 weeks, and actually developed a really good relationship with this patient. She's very appreciative of all the care and all the hard work that you've put in, and thankfully she's now being discharged. So she's made a full recovery and she's being discharged from the ward. As she's leaving the ward, she comes up to you and she says, "Doctor, I'm so thankful for all the hard work that you've done over the last few weeks. Just want to give you this lovely fancy box of chocolates." And she hands you over a really nice box of chocolates. Now, do you accept those box of chocolates? Would you accept them? Would you always accept them? Would you sometimes accept them, or would you never accept them? So what do people think? Just add in the comments, always, sometimes, or never, in terms of accepting a box of chocolates, a gift from a patient. What do we think? So we've got a never, a couple of sometimes, never. So we've got never. So yeah, we've got never, but that verbal expression of oh, you would verbally express your gratitude for the gift. Oh, so we've got one there, accept and share it with the rest of the team. Anybody else got any thoughts on accepting or not accepting that box of chocolates? Politely decline. So it's really interesting that you have all come up with different answers for that. We've not got we don't agree on the way forward in this situation. And actually, in this situation, there's not really any right or wrong answer. It is very much an individual decision for you. And lots of doctors I meet with will say that actually they don't feel comfortable accepting gifts from a patient. And if that is how you feel and you don't feel that you can accept a gift, then you may sit into the group who say never, and you would decline that offer. If you are declining the offer of a gift, especially if it's something such as a box of chocolates, then it's about politely declining it, being able to explain why you want to decline that gift, and doing so in a way that doesn't offend the patient and doesn't leave them feeling awkward about offering you a gift in this situation. I'd probably be more likely to sit with with Hanan. So I think if I was in this situation, I would be tempted to accept that box of chocolates and to share it with the rest of the team. So I would accept that gift on behalf of the team who have been working together and caring for the patient. So I would make it clear that the gift wasn't for me and I wasn't accepting it personally, that I was accepting it for the rest of the team, and I would make sure that the patient understood that. And then I would then share the gift with the rest of the team, whether that be putting it on a reception desk, in a breakout room, leaving it somewhere so that everybody can access it and everybody can have access to the gift that is being given from the patient. So the GMC guidance it's talked about in good medical practice is actually the very last paragraph of good medical practice, and it talks about doctors can accept gifts, and hopefully if you end up working in the NHS, you will receive gifts from patients on a regular basis, because patients want to show their gratitude for the hard work that you are doing and the treatment that you are giving them. So patients hopefully will often give boxes of chocolates, bottle of wine, boxes of fruit, that type of thing. And as long as they're not giving it in a way that is trying to bribe and encourage you to give them, favorable treatment or give them access to treatment quicker than maybe they would usually receive it, then there's not going to be any problem in you accepting a gift on behalf of the rest of the team. But the guidance does leave it open for you to either sometimes or never accept those gifts, depending on your personal beliefs and how you feel about accepting things such as that. So that's a very brief scenario. I'm conscious of time, so I'm just going to see what time we're on till. So we've got until 25 past. So we'll do one more quick scenario. So I'm going to think about prescribing now in terms of the UK, and if you were working as a doctor in the UK, and I'm going to say it's a Saturday afternoon. So it's Saturday afternoon here in Manchester. You're at home, you're having a relaxing day watching the TV, and there's a knock at the door. You go and answer the door, and it's your friend who's come round to visit you, and you let your friend in, you make them a cup of tea, and then your friend says, you know, "I- I'm going on holiday tomorrow, so I've got flights tomorrow morning, and I've run out of my epilepsy medication. Would you please prescribe me some medication in this emergency situation so I can go on holiday without worrying about about not having the right medication?" So in a situation like that, would you prescribe medicine to a friend or family member? Would you always do it? Would you sometimes do it, or would you never do that? What would people think about? So we've got a few quick answers coming through there. 4 people going with never, and then Jane at the end refer to their GP. And that is absolutely right. So the GMC guidance is very clear that you should not be treating friends or family unless it is a real emergency situation. But in this type of situation, I think exactly as Jane has said, there are other routes available for this friend or family member to receive treatment, and they could make an appointment with their own GP. They could perhaps go to an A&E department. We have things called drop-in or walk-in centres in the UK where patients can go and be treated. Could also go to the local pharmacist, and pharmacists in the UK are able to prescribe medication in an emergency situation if it is really needed. So very important, because I think this sort of scenario differs around the world, and in other countries around the world, it is the norm to treat friends and family and to prescribe for friends and family. But that is something that is very different in the UK, and we would expect that friends and family shouldn't be registered with you because you don't have uh, you're not able to treat them objectively. If you've got emotional connections and emotional ties with a patient who you are treating, then it's very likely that you're going to treat them differently than you would to a patient who you've never met before and who you don't have those emotional connections with. So that level of objectivity is absolutely key. There are always sort of times when you may be unable to follow the GMC guidance, and that would be in an emergency situation. If it was a life or death situation, then you would use your skills as a doctor and you would treat a friend or a family member if it was an emergency. But but in everyday life, you should very much stay away from treating friends or family. So just shows how some of the ethical scenarios can change very much depending on the country where you may have trained and worked previously, and how things work once you are in the UK. Hopefully that makes sense for everyone. I'm going to start wrapping things up now, conscious of time, and don't want to overrun into the next session. So there's lots of GMC guidance out there, and as I've said earlier, I'm not a doctor, so I'm not here to tell you how to treat patients clinically, and the guidance will not do that either. The guidance gives you very broad principles that will help you practice in a good way, a good and a safe way. So, they're very high level. They allow you to use your professional judgment and for you to interpret them in different scenarios, because every patient who you treat will be different and you will be treating different patients on a daily basis. Most important thing, I think, for doctors like yourselves who may be new to the UK, may have trained and worked overseas, is that all of the GMC guidance is ethically based and it is consistent with UK law. So if you are working within the UK, you follow the GMC guidance, you can be confident that you are working within the laws in the UK. So things around confidentiality and consent, if you follow the GMC guidance in terms of that, you do not have to worry about breaking the law in the UK in terms of consent or confidentiality, for example. As I say, the guidance gives you scope to use your own professional judgment in individual cases. And then finally, if doctors choose to not follow the guidance on a persistent basis or fall seriously below what is expected within the guidance, then it's likely to result in action being taken first and foremost by the doctor's employers, but then possibly eventually referral to the GMC. So as I've mentioned earlier, all of the guidance is available on the website. If you go onto the GMC website and look at the ethical hub, you'll be able to access all of the guidance. If in the future you are planning to come and work in the UK, if you are looking to join the medical register, then having an understanding of the guidance will help you during that process. And there is the learning environment. So the slide that we looked at towards the start. So you can go on to the website and you can explore the guidance in practical terms. So you can read case studies, you can watch videos, you can use assessment tools to test your knowledge and understanding in terms of the GMC guidance and what that means in practical scenarios. So I'd certainly suggest going and having a look at that if you are preparing to take PLAB 2 or if you are preparing to move over to the UK in the near future. We won't do takeaway messages because we've got a couple of minutes left, but no, if you are thinking about moving over to the UK, in the coming months or years, then do visit the website and have a look at the Welcome to UK Practice sessions, book your place on one. It gets really good feedback from doctors who are new to working in the NHS and the tips that it gives you and the help and support available. And then just a big thank you for joining my session this afternoon. Appreciate you giving up your time on a Saturday, whatever time it may be in the country that you are in at the moment. I hope that you found that of some use.